Hi, I'm Dr. Kush Gupta, and I want to thank you for joining me on another episode of Medicine Mentors, where we interview masters in medicine, leading physicians at the top universities across the US to learn from their experiences and derive key insights, traits, and best practices that can guide medical students and residents. Today, we have a very special guest, Dr. Jeffrey S. Berger. Dr. Berger is an associate professor of medicine and surgery and director of the Center for the Prevention of Cardiovascular Disease at the NYU Langone Health. Having authored several hundred research publications, Dr. Berger has been the recipient of several grants, honors, and awards, including the American Heart Association's Fellow Faculty Award, amongst many others. He has also established an independent NIH-funded research program investigating the role of platelet activity and thrombotic biomarkers in the cardiovascular disease. Welcome, Dr. Berger. It's our honor to have you here.
Thank you very much. It's great to be on with you.
So, Dr. Berger, could you take us through your journey to becoming one of the greats in cardiology? How did all of this start?
So I am a child of immigrants, and my parents came here. They really encouraged education. I would say education was by far the number one thing for me. To them, it was everything. And as immigrants, they looked at the healthcare profession with such admiration. And I think that had a tremendous effect on me. And I grew up with encouragement that the healthcare profession is great. I sort of went off the path because it was so ingrained in me. Not a lot of people know this. After I finished university, I worked in the mercantile exchange, which is trading commodities for a few years. I worked in the Twin Towers back in the mid-90s. And then along the way, I realized I really do like medicine. And I decided that I wanted to go to medical school. And I did things a little bit differently. I went to school in Israel. I went to Tel Aviv University, which for me was really incredible. It was a time when I think in the US, there was a lot of disappointment in medicine. I think people were doing extraordinarily well financially in the 70s and the 80s. And then all of a sudden, there was this big fall off. And I think a lot of people were a little bit dismayed. Where I traveled in Israel, people loved it. There was no financial remuneration. It was not about financial reasons why anybody went. And I just enjoyed it. And I wanted to be a clinician. I wanted to be a great doctor. I wanted to help patients. And along the way, when I did my residency, which was in New York at Beth Israel Medical Center, I went through every potential field. I thought about GI and pulmonary, and I remember thinking a lot about allergy and immunology. I loved immunology. And then I spent a month with someone named Thomas Killip. He is known for the Killip classification of heart failure, just a tremendous clinician, an astute clinician. And he had a tremendous effect on me and on my choice. And I went into cardiology because I thought it was the most dynamic of fields. And then from there, I realized I wanted to get some, what I call more formal training in it. I was asked to be a chief resident. At the same time, I applied for and I was accepted into a master's program. It was called the NIH K30 program to get a master's in clinical research. And my residency was extraordinarily supportive of that. I did it in my third year and my chief year. And really that gave me what I call the foundation to be a successful clinical researcher. So after Beth Israel and after Einstein, where I got my master's degree, I applied for fellowship and I wanted to be a clinical trialist. I wanted to be a clinical researcher. And I went to Duke University, the place where I thought had just really the best research. I was really excited to go there. And I went down to Duke for my fellowship. And I always tell people that in life, many people get opportunities. I think the successful person is the one who takes advantage of opportunities when they arise. And I think that's something that I was able to do, is that there were so many opportunities there, and I was able to take advantage of them. At the time, I was fortunate. I found my wife and I got married. And I remember thinking at the time that I loved Duke. I loved North Carolina. I thought I could be a great clinical trialist in the antithrombotic space. But I realized that we know so much about the heart. What do we know about the lower extremities? What do we know about vascular beds outside the heart? And that got me thinking well, that's an area where there's so much less known. I'm really interested in that. clearly there's a connection between the vascular system outside and inside the coronary arteries. So I went from Duke, I went to the University of Pennsylvania, and I got some additional training in that area. Another point that I forgot to mention that I think is really essential is at Duke, we were encouraged to write a grant. And I remember at the time writing a grant that I thought, that I would be competitive for. It was a fellowship grant. I think it was from the American College of Cardiology. And I thought that I would have a shot. And I remember somebody telling me, well, why don't you apply for a much larger grant? Why don't you apply for, instead of a 1-year grant, a 5-year grant? And I said, I can't get that. I'm a second-year fellow. I'm a kid. I know, there's no chance. But I said, sure, I'll work on it. I'll write it up. And that was probably one of the biggest lessons of my life. I did not get the grant that I thought I could get, the 1-year fellow grant. I did not get that. Instead, I got a much larger grant. I got a 5-year grant that basically transitioned me to my faculty, that paid for my faculty, called the Fellow to Faculty Award. It's like a K grant from the NIH, but it just starts in your fellowship. It's from the American Heart Association. And that launched my career. So I had my own funding at a very, very, very early age. And that to me was a really big deal. From there, things just grew. After the University of Pennsylvania, so I had my own grant. My first faculty position and my last, meaning I've continued to be at NYU, New York University School of Medicine. I joined NYU because I was very interested in clinical trials, and there was someone named Dr. Judith Hochman, who is a legend in the world of clinical trials, but I was also very interested in platelets and thrombosis. And there was a platelet biologist at NYU. His name was Simon Karpatkin. He was the head of hematology at the time. And I was very excited. I was going to work with Dr. Hochman, and I was going to work with Dr. Karpatkin. And then my life changed drastically. I came to NYU, and Dr. Karpatkin passed away within a few weeks of me getting there. And I realized that if I wanted to do platelet work, if I wanted to sort of do mechanistic work, I needed to do it myself. So once you identify problems, then we work on, how we can prevent them. But it's really sort of, I was able to follow my passion, ask fundamental questions that I had and try very, very hard to answer them with all the tools available. I will say one other thing. I think it's really important to do something that you love. Because if you like something and if you love something, then you'll be happy, right? You'll wake up every day and you'll be like, wow, today's a great day. And I get to answer a question that I think is really important. And if you love seeing patients every day, then that's what you should do. If you love asking questions, well, you should ask them and try to answer them. And if you love both, meaning I'm blessed, I get to do both, that is incredible. But I really think you have to follow your heart. I think you have to follow your passion. I think it's also good to have sort of this overarching fundamental question. I have a funny story, but also, a story that really impacted my career. I remember when I was a fellow at Duke, and I remember this vividly. I was on my way to a heart meeting, and I was sitting next to the emeritus chief of cardiac surgery, and he was asking me, what are you doing? And I said, I'm on my way to the heart meeting. And he said, oh, what are you presenting? And I told him I was so proud of myself. I was presenting 4 or 5 abstracts, and he asked me what they were, and I told him, and he really put me down. He basically said, that is completely useless. He basically said, how is that going to help people? He basically called me out on just trying to get publications or presentations for the sake of getting publications or presentations. And he basically said, if you could do something, what would you do? What is it that you want to answer? What is it that you want to be known for? Ask a question that you think is important. And I got to tell you, I did not cry. I did not sort of feel bad. I did it. I tried to think, what is the question that I wanted to answer? And the question for me that I think really I was able to ask at that time, and I continue to ask, is why is it that when you think about lipid-lowering drugs like statins, you measure lipids? And when you think about blood pressure-lowering drugs, you measure blood pressure. Yet when you think about platelet-inhibiting drugs, what do you measure? Who should be on aspirin for the prevention of a first heart attack or stroke? The data, by the way, is all over the place, but it works, right? So why is it that we can't figure out an individual's platelet function and then figure out who should be on an antiplatelet therapy drug? And that's really what my career has been trying to do. can we measure platelet function? And my laboratory is really focused on that. And I think the answer is yes. And then once you measure platelet function, does it correlate with events? We have a lot of data to suggest that it does. And that's sort of what we've been doing. And then the last part, which to me has become really probably one of the most important, or maybe the most fun for me, so I think it's most important, is why. Why is it that platelets are inducing all these types of problems? It's much more than just clotting. Platelets clearly are involved in heart attacks and strokes, which are clotting disorders, but they're also involved in buildup of plaque, in atherogenesis. They're also involved in inflammation. And understanding why that is and how that is, I think, is really a key question that I think can open up a lot of questions. In the last few months, we've been doing a lot of work with platelets in COVID-19. We have a lot of data that platelets are important, not just in thrombosis, but in the pathogenesis of the disease. So that people that die more frequently, people that require mechanical ventilation, people that become critically ill, that platelets are playing a role. And we're actively working on that. So I think these platelets are very versatile cells that have a large role in a lot of diseases. And that's what I've been doing. And I just think it's been a lot of fun because I get to ask a lot of questions and I try to answer them one by one.
What was the transition point when you decided to become a physician from marketing?
Deep down, I really wanted to work in the healthcare field. I think personally, it was very personal at the time. I was brought up where the healthcare field was so important that it was sort of my, I would call it, period of rebellion a little bit. It was my idea that, you know what, I just want to do something different. I want to do something that I thought would sort of not be in that mold. And I tried other things. I was trading heating oil. I was working in the commodities pit. I mean, I remember it was really a fun adventure. But then I realized that I like medicine. I do. And I like learning. I like helping people. I can't think of a field where you get so much benefit for yourself and you get to help others. It's an incredible field that you literally wake up. People really are appreciative.
So what are the stories or events behind your success? We've discussed some of them, but if you could tell us more about the events or a major event or someone who had the most profound effect on your life.
I think the people that have had the biggest impact on me from a professional perspective, I mean, obviously my parents have been just incredible, really made me into who I am. And they've provided just this incredible source of being a role models and support and push. But professionally, it's been my mentors. I mean, you know, it started with someone named Dr. Brown. He allowed me to take advantage of opportunities. He provided me with data. I remember this very vividly. Everybody would go to this guy. He was a cath lab doctor. He was the head of our cath lab. Everybody went to him. Everybody who wanted to do cardiology at least went to him. And he would give everybody a small piece of data and you would have to write a paper. And I remember I did it. And when I was done, I said, "Can I do another one?" And he looked at me. He said, "Another?" And I said, "Yeah." And I did another one. And when I was done with that, I said, "That's great. Can I please do another one?" And he then told me a few weeks or months later, I don't even recall anymore. He basically said, nobody ever went back. People did the thing and then they stopped. But we live in a world where whatever everybody does is perfect. And for me, it was great to be told that I was not perfect and that I could do better and that more was expected. And I think that was one of the things that really helped me become successful.
Creating an environment of encouragement to bring out the best of the student. So what are some of the challenges that you had to face along the way?
First is there's a lot of discouragement. There's a lot of rejection. So if you have thin skin, it'll be very hard to be successful. If you think your stuff is just going to be perfect and it's going to get into the first journal or you never make a mistake, boy, are you in for something. Because you have to be ready to be told that your stuff is not perfect and that there's a lot of work that needs to get done. And I think that needs to be a big part of it. I think having thick skin is really important. I think perseverance is really a key element of success. You have to persevere. You have to be okay with If something doesn't work the first time, the second time, even the third time, to try harder, try again. To me, that is a key for success throughout your career. You're always going to be told, this is not good, it's not great. There are some people who have the perfect pedigree. There are some people who have the perfect ability to write. There are some people who have the perfect ability to design the perfect experiment. There is the perfect clinical trialist. I'm not perfect in any of those. I just try. I try hard.
So what advice do you have for residents when it comes to patient care?
I think when you're taking care of patients, I think it's essential to realize how important you are. I think it's important to not take it for granted. I think it's important not to take it lightly. That means do your job seriously. When you're taking care of a patient looks to you as your healer, right? You need to help them. You cannot look at the clock. You cannot be like, oh my gosh, I have to leave in 5 minutes or I have to leave in a half an hour. You have to think about how you can best take care of your patients. One of the most important things you can do, we become really good at fixing problems so that patients can go home. We're not great at understanding what the problem is. I really encourage people to think and to read and to go back in the literature and to really understand why they are sick for the first part. Why did they have to come in? To me, that I think is extraordinarily important.
So having taught thousands of medical students, residents, and fellows, what are the common traits and habits of the most successful of these that you've come across?
I think the person who is successful is the person who perseveres, is the person who tries hard, is the person who is curious, who at the end of the day goes home and reads about the patients that they saw, is the person who says, I want to know why did the person come in, not just how to treat them and let them go home. It's the person who continuously asks questions. It's the person who cares at the end of the day, right? It's not just a job. It's a person who thinks about it even when they leave, because that's ultimately, I think we have the ability to help patients. And by the way, a lot of times it's not making the perfect diagnosis. A lot of times it's just listening, being there for the patient and really caring. Because if you do care, they will know and they will appreciate that. And I personally think things like that help patients get better.
What is the one thing that you wish you knew when you started this journey, say at the age of 30, 35, that you know now?
I used to think that if I worked really, really hard and if I did a lot of things, it will get much easier and better over time. That does not happen because when you do better, when you're more successful, they want you to do more and more things. It's fun and I love it, but I thought naively, I'll just do this. I'll work really hard for 5 years, then in 5 years it'll be easier. I'll have more time. No. So that doesn't happen. At the end of the day, you have to make decisions, right? And you have to make decisions that impact you, that impact your family, that impact things that you care about. Maybe I can't write 30 papers in a year. I would rather spend more time with my family and write 15 papers. I think finding the right balance is something that I think took some time through a lot of experience.
Wonderful, Dr. Berger. It's been a real honor to hear your wisdom and your experience and to really dig deep into the principles that you've used to become the person that you are today. I really, really appreciate your time.
Of course, it's my pleasure.